Hi, this is an educational video on how to collect umbilical cord stat for drug screening for our umbilical cords. So you will notify the provider that you need a segment of cord. You want to get about 6 inches the size of your hand. Once it's handed to you, if it's clamped, you'll want to unclamp it, and then you need to strip the blood from it. So holding from the top, you can milk down, and you might need to milk it a few times to get all the blood drained. This cord does not have a whole lot. Once you're done stripping the blood from it, you're going to rinse it either with sterile water or a flush. So I'm just going to squirt it off. And depending on the cord, you might not have to rinse as much. And then you're going to want to pat it dry. So I'm just going to kind of so then it's fairly clean. If you do have a large section of blood, you can trim the cord to get the last little bit out, but this is fairly clean. And then we will put it in our container. Close the lid. Okay, so this instructional segment is covering paperwork. There's going to be 2 forms. One form is from Quest Diagnostics. This is required by the company to go with the cord stat. And then the other is required by Prisma Health chain of custody for who touches it and how it gets down to lab. So for step 1, you're going to apply baby label. This order is going to live on baby's chart. So you will get your baby label and affix it here. And we're going to have a laminated copy for reference. Then you're gonna fill out section C, and it's gonna be baby's medical record number, and then you'll put in the baby's last name, baby, and whether it's a male or a female. F is your unit phone number and unit fax number, so that will vary by location. You'll check for reasonable suspicion or cause, and then select other and write in umbilical cord. Then you will check which section. If this form is filled out for meconium, you would not select other, you would check meconium and then select whichever one applies. Step 2 is not filled out because that is for urine only. Step 3 is where you sign and date of when you collected. This specimen release to will always be Quest Courier. And then step 5, we prefer for it to be completed by the donor, so that would be mother. If mother refuses, you, the collector, would fill this out and you would denote that you are the collector. Then these are the labels for the cap. If the mom will not initial here, you would initial. The Prisma Health chain of custody. So the nurse would fill this out. You would fill in the information for the patient, and then if you are taking it to the lab yourself, you would sign and print and put the lab there. If you're gonna have a PST or a surgical tech take it for you, you would need to put their information, and then they would put their information on line 2 into the lab. Everybody that touches it needs to fill out the form. This next segment is going to be how we will label the specimen cup. These kits will be this lovely little box here and the paperwork. The location of these kits will vary per campus, so your educator will let you know where these will be located. But after you grab your box and your form and you filled it out, well, initially you will open this to get your specimen cup, but we already know our cord's in here, so we filled it out. These peel right off. It says place over cap, so you will put over the cap and down the side. Get your second over the cap and down the side. Then you'll get your baby label and pick a spot that won't cover. This is a triplicate paper, so you take off the edge. This tells you exactly what copy goes where. Copy 1, laboratory, and that is the laboratory that is running the specimen, so you'll want to fold this to go in your lovely little bag. Out. The bag tells you directions as to what goes where. Step 1, place chain of custody form in large pouch. We have a large pouch. This is the chain of custody form it is referring to. Large pouch. Step 2, place specimen in small pouch. Small pouch has this lovely little piece of paper in there for the specimen. Into the small pouch. Step 3, remove release liner from flap. And step 4, fold blue adhesive flap to cover blue crosshatch slit opening. So this removes and you have sticky, and the blue little sticky goes to the blue crosshatch. Like so. You're sealed and beautiful. This goes inside of the box. Copy 2 is the collector's copy, so this will stay with patient chart. Copy 3 is the employer copy, which in our case, this is not a drug screen for an employer, so this can go in the shred bin. And then copy 4 is the donor copy, so you would give this to mom. So this then is closed. And then you will have your Prisma chain of custody, and you're ready to walk down to the lab.